only request is that we call all our guests and say that give us at least two opportunities. Don't go by one. So I think my mandate in BIC as founder is till 30th June 2024. Before that, we will have World Health Day. So whatever your experience here right now, you must promise to come at least on next World Health Day. That is one thing. That is 7th April. After 2, it's your call. If you think that we are duplicating others' work, if you think that we are not adding to anything, then even we will not take it forward. About manifesto that you said, that is exactly we'll be doing. All this would be made into a medical manifesto, all the inputs that they come in. About Prashantji's presentation, we know about the highest rate, etc., but when you put that in numbers, 1 lakh under 5 years, you have mortality, 1 lakh children dying, that's a substantial number. So I think that's what we said. This is something, and I've been seeing at least for 30 years now that MP has this wooden spoon. It's the last state in this. So we will try and discuss with you more on this. I'm not a medico, so I don't understand the early initiation thing. So I'll skip that. But it's impressive to see that during COVID, UNICEF tried to bring the focus back to other diseases also. Even this was known to us, not known to us, that drive-in also was. I thought it was done by MP Tourism. It was a wonderful initiative that you collaborated. You must actually. So I am now for आपके पास ही ला रहा था. I'll just open the floor to people. उसके बाद we have Dolly ji's presentation after 5-6 questions. आप देखिए.
अभी जो दोनों प्रेजेंटेशन किए गए श्री गुलाटी जी और डॉक्टर प्रशांत द्वारा बहुत ही बढ़िया प्रेजेंटेशन थी, बहुत ही आई ओपनर से। और तो सीआरसी की बात की, पूरी बात तो यूनिसेफ ने शुरू से की और इसी कारण से चाइल्ड राइट्स फोकस में आ पाए। लेकिन डॉक्टर प्रशांत ने जो प्रेजेंटेशन किया उसमें जितने भी बच्चों से जुड़े पैरामीटर्स हैं, हेल्थ पैरामीटर्स, चाहे वो पैदा होते समय इनफेंट मोर्टेलिटी हो, चाइल्ड मोर्टेलिटी हो या मदर मोर्टेलिटी हो, सब में वर्षों से पहली बार नहीं हो रहा। जैसा बताया डॉक्टर प्रशांत ने, हम कहाँ पर हम वर्षों से टॉप पर हर साल थोड़ा सा सुधार होता है, लेकिन हम टॉप पर बने रहते हैं।
टॉप मतलब बॉटम। अच्छा बात, हाँ बस
या उसको बॉटम समझ लीजिए या टॉप समझ लीजिए, जो भी जिस तरह से कहना चाहे, हम थोड़ा सुधार हो पाता है गवर्नमेंट एफर्ट से या और तो सिविल सोसाइटी के एफर्ट से, एडवोकेसी एफर्ट से, इनसे। लेकिन बहुत बड़ा चेंज नहीं हो पाता। हम हमेशा प्रॉपर बनी रहती, बल्कि ये कहना चाहिए कि मध्य प्रदेश इस तरह के पैरामीटर हिंदुस्तान की राजधानी। आज डॉक्टर्स डे, हमें चाहिए कि हम सारे डॉक्टर्स थोड़े कम है, शायद बाद में जैसा आप कह रहे हैं को उपस्थित हो सके। हम कोई इसके ऊपर छोटी सी कोई डिबेट रखें, बातचीत करें और कोई रिकमेंडेशन दें जो गवर्नमेंट को भी दी जा सकती है, या जैसा आप कह रहे हैं कि इंटरनेशनल बॉडीज को या यूनिसेफ के डिपार्टमेंट को दी जा सकती है। इस दिशा में हमें कोई कोशिश करना चाहिए।
थैंक यू वेरी मच जी।
अपने चाहों तो मैं थोड़ा सा आंसर कर देता हूँ। पहला तो सर पैन के रिपोर्ट बहुत पहले चाइल्ड राइट्स ऑब्जर्वेटरी में बच्चों की स्थिति बनाई थी, आज से करीबन 6 साल हो गए, 2 बनाई थी। उसके बाद वो थोड़ा रुक गया है। मोर देन वेलकम टू हैव अ पैन प्रदेश, पर रिपोर्ट जाती जरूर है, बट पर्टिकुलर एक इशू जैसे कुपोषण पे चलेंगे या शिशु मृत्यु दर पे चलेंगे। सर आपका जो कहना था जो शिशु मृत्यु दर के लिए निवेदन ये रहता कि अटल बिहारी इंस्टीट्यूट ने एक टास्क फोर्स बनाई है शिशु मृत्यु दर और मातृ मृत्यु दर के लिए। तो अगर बीआईसी उनके साथ कोलैबोरेट करेगा, अगर हमारे से कोई टेक्निकल सपोर्ट चाहिए वी विल मोर देन हैप्पी टू। थैंक यू।
Another wonderful suggestion. Broadly we agree. Rest we'll discuss with doctors and you can take it forward.
Survival of the child. What about improving the quality of life?
मैंने बोला था कि article that talks about survival life includes the quality of life, includes everything. It's not survival doesn't, and the reason I'm talking about more of survival was what Prashant was telling us, that we have children losing in our state. You know what? Something that Prashant said, and I would like to repeat it. He said the early initiation of breastfeeding. मतलब बच्चे का जो पहला गाढ़ा दूध है जो हमारे टेबल साइड में देते हैं जिसको कोलेस्ट्रॉल कहते हैं वो बच्चों की जान बचा सकता है और अगर 6 महीने तक कुछ ना कुछ बच्चों को मां का दूध ही दे तो यू कैन सेव 22% you can save IMR. Definitely that's the reason we are talking more on survival, but CRC talks about quality of life, healthcare, drinking water. It also talks about all the possible options which good health should be created by government. It has a response. The government has a responsibility to create that. But you also know that I also know that these things don't change over the time. It takes time. Why we are saying here is because private sector has also a role to play. You people can make a difference or majorly because healthcare is not only about government; it's also about private sector. So you are right. I 100% agree.
The second thing is that when we open the daily paper, whether it is Denipascal or Times, the first 4 articles are on violence against children, whatever form. So how can we as a team of BIC or UNICEF or WHO or the Women's Society which deal with adolescent and women health or volunteer agencies also help to reduce this? It's so painful.
Ma'am,
because we can keep talking in these August audiences, but actually the practicality of life is very bad.
Ma'am, I
even
agree.
In the urban slums.
I agree, and I am actually thankful to you to raise this issue because on violence also, Madhya Pradesh, violence against children, we are on the top as per National Crime Record. Bureau data. The highest number of violence against children happens in Madhya Pradesh. Though government also says that it will be right is that we also have a mechanism of monitoring. So if we have a mechanism of good monitoring, we will find cases go high. That's also possible. But ma'am, UNICEF does its work with government. We try to push. We are the state to have the first child protection policy in Madhya Pradesh. But you are absolutely right. We have a challenge not only in slums, in urban areas, in affiliated societies, poor societies everywhere. We need to make a difference for these children. More than happy, and doctors have a role because you have a role on POXO, you have a role on JJ Act, you also have a role on PCPNDT Act, which is also violence against children. We'll be more than happy if you want to have a session from us to come and talk about it. More than happy. We also have a trainers and we work with a lot of NGOs in Bhopal who work in slum areas. But if you need more help, more than happy to collaborate. For anything for violence against children, please count me 100%.
That brings to the last, the broader question. Anyone else who wishes to ask specifically about UNICEF? किसी को पूछना है कुछ और? अग्रवाल साहब कुछ आपको पूछना है? So I'll ask the broader question to begin with. Do you really think that BIC, as founders, we've only guaranteed the minimum thing that we'll explain in the evening, but all the verticals, minimum, Dr. Washni, etc., can guarantee. But it will be taken to its optimal level only if the ecosystem supports it. So at the outset, we want to ask you, like you said about the manifesto inputs. Our intention is that you are doing manifesto inputs, we were not aware. That is exactly what is happening here, that people in silos, so we should not be duplicating the work. Okay, duplication has value addition and force multiplier. So do you really think that there is space for a medical vertical here? Are there gaps? Because we thought, we've never seen a national body and a state body sitting together in Bhopal. I mean, they individually go to the government, state body goes to the government, national body goes to the government. You have a national government, you have a state government, they don't meet them in an integrated manner. Besides, when you go to the government, at most your representatives go. But when the minister comes here, it's a different ballgame. He gets more ideas from more prominent people. So in that context, do you really think that there is space for a medical vertical?
Sir, I always say that civil society in Madhya Pradesh has a role to play. There is a huge need for having more forums like you have BIC, you have medical forum. Definitely there is a space. how do you work with government? That's something which you have to work on because government will have to acknowledge your presence. If we have any reports you want to use from Minister, more than happy to share.
What is your take? Though you are new, but my submission is that in an underdeveloped state, like people ask me, why did you choose medical as one of the core areas? Education is very important, but to me, medicine in underdeveloped states is relatively more important. So, do you really think there is space for medical vertical like a thing here, or would we be duplicating stuff?
I don't say it as duplicating stuff. Actually, yeah, any contribution in the right direction definitely adds value to it. If everybody starts talking about the issues for the child, like the issues I highlighted, like early initiation of breastfeeding, the moment the baby is born, you have to breastfeed. So that is not the practice you see in the private sector. So it's not that one professional body or one UN body can talk about it and bring the changes. It is everyone who need to speak about it. So definitely you're most welcome to bring up these issues and work in that direction.
Before we call Dolly ji, there's a small formality here. To all our guests, we give a small certificate as a to become the honorary members. So I would invite Dr. Vashne and Raghurat ji and Dr. Vashne and Agarwal sir to give the honorary membership to Gulati ji and Dr. Prashant. Dr. Vashne ji. Dr. Vashne, Dr. Vashne, they wish to leave now, and they've overstayed, but we repeat our request that we must come at least once more before next year, at least once more, and we'll keep you updated.
No, we come because he's traveling from Indore. I came from Seoul.
Thank you very much.
To be part of it.
Thank you.
Thank you. Thank you very much.
Not offered. Please sit. Thank you for coming. See you.
Sorry, ma'am.
Right. I'll get in touch with you.
We now start the third so-called in-house presentation. Dolly will now talk about the theme of 2023 Doctors' Day, family medicine. Somebody's forgotten the specs.
I think the people will say. So both your specs? Specs. So good evening. It was going to be an afternoon session. Thank you, Dr. Subodh Vashne, Mr. Shashidhar Kapoor, and Mrs. Preeti Tripathi. And I have been given the honors to speak on family doctors on the front line. Today is 1st of July. It commemorates the birth anniversary and the death anniversary of Dr. B.C. Roy, who's the father of Indian medicine. And it has been declared as 19th May was declared as the World Family Doctor Day. So why do we focus on the family physician as in the front line. Next, please. So we know every doctor, and we think that seeing the Bollywood movies and the Hollywood movies, that every doctor is a superhero in a white coat. है ना? सफेद कोट में डॉक्टर भगवान है. And their selfless service to mankind deserves our sincere gratitude, though I'm patting my own back at the same time. So the theme of National Doctors Day in India started on 22 last year. And even the PM office has carried on that the family doctors on the front line highlights the contribution of the service and dedication of the doctors. Next, please. So what did COVID as a pandemic give us? It gave us a lot of lessons, and we realized that we were not prepared. And all the research and groundbreaking research, scientific data came to us as novice, because we as experts, Dr. Subodh Vaishne, Dr. Skand, Dr. Ajay Goenka, all the heads of the institutes and even the government institutes, they realized that they were facing a pandemic which nobody knew anything about. And it was as we managed our patients to a certain extent very successful in the first phase, and we managed the vaccination program post-COVID in the first phase, that we realized that the doctors play a crucial role in maintaining overall healthcare system. And according to the reports, during the COVID phase, 80% of us were highly stressed, including our technician, nurses, and our paramedical workers. And still they continued working, losing their sibling, their parents, their family members. I saw at ground level at Siddhanta Super Speciality, and also my other colleagues in various hospitals, we saw them working hard, very, very hard, and 12-hour duties in very uncomfortable clothes. We could not even send them to the toilet for the 12 hours. So it was a very painful experience. So I feel they all deserve an applause from this scanty audience over here. Let's give them applause. Okay. So, and 40% were stressed due to the fear of the violence. If the patient recovered, everybody was very happy. But in the second phase, because the loss of infrastructure, oxygen cylinders, oxygen supply, the illegal use of medicines, it traumatized, because none of us really knew what we have to take. We were gulping down medicine prophylactically also in fear that we will get COVID. And because of that, many of us felt we were not real heroes. So phase 2 of COVID was very, very traumatic for most of us. We lost our siblings, we lost our parents, and many of our other doctor, paramedicals, and nurses also lost their parents, and so on. Next, please. So what is a family physician? Do we need a family doctor? If you realize 30, 40, 50 years ago, when we were small kids, we used to always go to the next door doctor. Though I am a doctor's daughter, but I know that the compounder, you would come to vaccinate it along with the gentleman. So that is why a family medicine medical specialty is within the primary care that provides continuing comprehensive health care for individuals across the families, across all ages, genders, diseases, and parts of body. That means they will treat our grandparents, they'll treat our parents, they'll treat our children, they'll treat our grandchildren. And that is how a family physician was conceptualized many years ago. But today, we as doctors always want to further specialize ourselves. So we become MD/MS, then we think of doing DMs and MCH, and then also we want to do super specialty fellowships. And ophthalmology remains a little behind, being only ophthalmology and fellowships. So therefore, I'm taking over the role of the family physician at the moment. So the specialist, who's usually a primary care physician, was named a family physician. Next. Next, please. So they are also the ideal members and leaders of the healthcare system, partners of public health, because of comprehensive care of unselected patients with undifferentiated diagnosis, whose practice is not defined by diagnosis procedures, but by human health needs. Family physicians do not treat diseases. They take care of people and act as leaders in front line of health workers. Next. So what do we look as a patient in a family doctor? Somebody who treats you with respect, listens to your opinions and concerns, encourages you to ask questions, explains things in a way you understand. When we go to super specialty OPDs, and I faced that with one of my siblings, from 9 to 5 in the evening, a patient was given an appointment at 9:30. We remained waiting for the doctor. The doctor never came. None of the staff ever came. And it's in one of the leading hospitals. So I feel if there was somebody to take care of, even a resident doctor, who would have solved, who would have admitted the patient, it would have been wonderful. So this is why a family physician comes in. And she was for a super specialty reference. Next, please. So the function is that they listen to the patient, they order, perform, interpret, test to diagnose the condition, explain the results to you, monitor your progress, and re-evaluate your treatment when necessary. Next, please. Next, please. So we know family physician and we know internist. Internist is used more in USA where they treat only adults. And a family physician will treat adults, adolescents, and also children. Next. So in the developing country like India, 50% population still want to seek informal healthcare providers like professional healers and pharmacy owner. और ये मैंने बहुत सारी कैंप्स की हैं मध्य प्रदेश, राजस्थान और गुजरात में, और वहाँ पे जब हम डिस्ट्रिक्ट हॉस्पिटल्स में रहते थे 5 दिन और कैंप करते थे, तो हमें हमेशा दिखता था कि छोटा वाला जो घर है उसमें एक लंबी लाइन होती थी ट्राइबल्स और विलेजर्स की, और उसमें ये पता चलता था कि सर का जो लीडिंग सर्जन था, उसका जो कंपाउंडर था, वो उसके प्राइवेट पेशेंट्स थे, because he gave more time than the MS and MD doctor to the patient, and he earned more also, and he was a very popular figure in that district. So that is how it is. The tradition of family doctor is gradually declining in India because everybody wants to consult a super specialist or a specialist. And this is also that none of us want to actually practice only family medicine and write parchees, as it is said. We all want to be super specialties as doctors. And we can conceptualize these changes that the Indian healthcare system faces into 2 entities, the healthcare supply challenge and the demand of healthcare. Many diseases and specialties have emerged in the last 3 decades, and therefore the role of family doctor has diminished. Because of this important missing link, we are seeing gaps in the healthcare delivery. And hence, people have lost trust even in the specialty healthcare facilities. Nobody wants to go to a big white hospital. They prefer to see a local general practitioners unless it's an acute emergency. Next. So what is a GP and what is an internist we've dealt with. Now GP, even if in the States or in UK, if you as a doctor change your resident, you have to reapply for the license of the other state. Your patients, if they move from one to another area, they also apply to become members of that society and the GP practice. And in fact, they have history more than 50, 100 years ago. They have records of the great-grandparents also with the general physician, whoever is the general physician. Everything is recorded and tabulated, which I think our Indian system lacks. So your family doctor can be a good referral center system. And if you had a headache, we won't see a neurologist. If you have retention of urine, you may need to see Dr. Saurav Jain. And that is how the whole thing goes. So a family doctor is a good way of primary health care, so the system should be encouraged. It is not necessary only for the MBBS or MD doctor to be a family doctor. It can be allied sciences also which work, like Unani, Ayurveda, and naturopathy, homeopathy. But if there is an acute emergency, the practitioner has to differentiate and immediately refer to the specific specialist. Then second thing I would like to tell you is this will bring out more epidemiological research and publication, which will help in screening for diseases also and also for treatment management in future. Lastly, it will help in preventive health, especially of communicable diseases, whether it is malaria, dengue, typhoid, or it may be SARS-1, 2, or it may be influenza, or it may be Omicron, or COVID, and COVID-4 may be also coming. So that is the way we have to manage. And I think having a next slide, please. The load on the tertiary health facilities, whether private or government, will reduce. If we have family medicine as a subject in MBBS, as a specialization is MD family medicine, I think the load on the super specialties, what do you say, doctors? In every single stomachache does not require referral to Dr. Gaurav Kohli. है ना? A family physician can give you if you ate too much and take an antacid today, do fasting for 6 hours. That would help. है ना? Everything does not demand a laparoscopic or a laparotomy. Nahin? So that is the way it is. Every pain in abdomen cannot be treated. Like every headache is not a brain tumor. It can be a spectacle error. It can be overuse of computer vision syndrome. All children faced during the COVID and are still facing. So that is how we have to manage. So that way we can let the specialist only do very specialized work. So the specialist doesn't get tired because they really need to use their skills to make the patient recover. Next, please. So I would advise BIC and Dr. Subodh Vaishne that we should have all this included in curriculum. Dr. Arvind Rai is not here. I spoke to him personally. So he said in many states in the MBBS curriculum, it has been included. Diploma and fellowship have started in family medicine, but it has not been included in the MP medical education as yet. So we can put up from your side to the cabinet. So India is a rapidly increasing population. We need to have affordable quality healthcare to reach everybody, whether it is rural, urban slums. And it can be done only in a decentralized manner by having a department of family medicine and training of doctors and retraining them in attitude towards the patient as a general physician. Next, please. So this is it. And I think the National Health Mission is emerging. Ayushman Bharat is there. Private sector is also venturing into primary and community-based healthcare facilities. I think the best for the last 15 years from where I joined, and it's not, again, not patting our backs, BMHRC did excellent work in going into the periphery of the gas victims and also the rest of Bhopal. So I think that was a very good system for us to add on to. Next, please. And thank you for a patient listening. And as Mr. Shashidhar said, it's a bilingual. So next time I'll speak in Hindi if you all give me a chance. And the third time I think I'll speak in Gujarati. Okay, bye. Thank you.
Thank you for a wonderful presentation. These are two things that we have focused on. One is to get a vision, and the other, if we could do one thing, we would not merely revive BMHRC, but we would try and resurrect it. Just imagine the 4 core areas that I discussed. If instead of there being only a Chief Justice there as director, if there were 4 people, one each from each of these categories, one top journalist, one justice, one person from uniformed category, and one top medico, if there was a body of these 4 persons, it would have been very, very difficult for anyone to scuttle the MHRC. We would still try and revive it, perhaps resurrect it. This is a wonderful idea that we could send to the government, that they must include this family medicine in their curriculum, especially if other states have already included that. As a layperson or a non-medico, I won't say I'm confused, but I'm not very clear about how is family medicine now different from general physician of yesteryears. To the best of my knowledge, the family medicine chap is also a specialist, but he only enters at the primary stages, whereas a general physician in the olden days was merely an MBBS. Is that correct, or is there some difference What is family medicine different from a general physician of past years?
They would have a separate curriculum.
Separate
They would
curriculum.
have a degree, it would be MD degree.
Okay.
Right now, as an MBBS doctor, using my MBBS degree, I can write, okay, your child has fever, does he have drug allergy? I'll take the temperature, examine him, and give him whatever syrup for the child, that is upper URI, or it's a loose motion, that I'll give him a treatment accordingly. But with an MD degree in family physician, we would be making a curriculum. Hopefully, there would be a curriculum. Like if I'm an eye surgeon, I know what is my curriculum to practice. And those parameters they would practice, but it would again cover all genders, all age groups of the family. And it would lessen the burden on the super specialty government sector and health sectors in private.
So what I gather is that it is even more important for an underdeveloped place like Bhopal, so that we can reduce the load on super specialists.
Yes.
It's even more, relatively speaking,
Yes.
it's even more important.
And there is patient frustration also. With slight fever, if a mother is sitting with the child from 7 in the morning till evening, till the doctor gets, just for a super specialty consult doesn't make sense. A family physician can play a better role.
Before we move on to the next session, the second most important session about COVID. You've come, Dr. Kamini Mehra is here. Anybody else who wants to ask questions about family medicine? I'll just point out to two more trends, again as an intellectual, not as a medico. One is about private medicine that started in Europe, but it's not catching up. And before that, but has he come?
Yeah.
Acha, you. Sorry, I didn't recognize you. So before COVID, we'll have a session on cadaveric transplant by Dr. Rakesh Bhargav of Kiran Foundation. About 7 to 10 minutes, followed by interaction.
Thank you. Thank you. Hello. Thank you, Subodh sir. Good evening, ladies and gentlemen. Organ donation. वसुधैव कुटुंबकम, ये विश्व हमारा परिवार है, ये हमारी संस्कृति है। कितना प्रेम होता है उन रिश्तों में जब जरूरत पड़ने पर वो एक दूसरे को रक्तदान या लिवर किडनी का दान देकर नया जीवन देते हैं, और कितना धन्यवाद और कृतज्ञता का भाव होता होगा उस व्यक्ति और परिवार में जिसको हम अपनों का अंग देकर नया जीवन देते हैं। ये अवसर है हमारे पास अपनों से अपना परिवार बढ़ाने का। इसे ऑर्गन डोनेशन के बारे में लगभग सभी लोग जानते होंगे। ऑर्गन डोनेशन इज द प्रोसेस ऑफ रिमूविंग टिश्यूज और ऑर्गन्स फ्रॉम a live or recently dead person। वन डोनर के से एक व्यक्ति 8 से 10 लोगों को नया जीवन दे सकता है, 2 लोगों को नेत्र रोशनी दे सकता है। इस त्वचा दान, स्किन डोनेशन से भी बहुत लोगों की मदद हो सकती है। हैंड डोनेशन से भी हम जीवन सुधार सकते हैं। नेक्स्ट, हमारे हिंदुस्तान में हर 10 मिनट में एक व्यक्ति ऐड हो जाता है, ट्रांसप्लांट के लिए रजिस्टर हो जाता है, और हर 17 मिनट में एक व्यक्ति की डेथ होगी। हमारा परिवार इतना बड़ा है, परिवार में इतने लोग हैं, उसके बाद भी कुछ परिस्थिति ऐसी होती है कि हम एक दूसरे को लिवर किडनी नहीं दे पाते। तो उसके लिए हम कोशिश ये करते हैं कि अगर हम मृत्यु उपरांत अंगदान करें तो शायद ये नंबर बहुत कम होगा। हिंदुस्तान में हर 34 मिनट में एक ऑर्गन ट्रांसप्लांट हो रहा है हमारे हिंदुस्तान में, जो कम हर 3-4 मिनट में होना चाहिए, ताकि 10 गुना ऑर्गन ट्रांसप्लांट होगा, तब हम डेथ जो ऑर्गन ट्रांसप्लांट के वेटिंग में डेथ होती है वो कम कर पाएंगे। नेक्स्ट, अभी हमें इतनी ज्यादा जरूरत है, लगभग 5 लाख अंग और 1 लाख कॉर्निया हर साल चाहिए। हमारे भोपाल में लगभग 300 लोग कॉर्निया के लिए रजिस्टर हैं, कॉर्निया ट्रांसप्लांट के लिए, और रोज 40-50 लोगों की मृत्यु होती है। अगर रोज 2 लोग भी अंगदान नेत्रदान करेंगे, 10 लोग भी, तो रोज 20 लोगों को नेत्र रोशनी मिलेगी और 1 महीने में शायद हमारे भोपाल की वेटिंग्स खत्म हो सकती है। नेक्स्ट, 5 लाख ऑर्गन हमें हर साल चाहिए। नेक्स्ट, ब्रेन स्टेम डेथ, ये सभी को जानना जरूरी है। इसका ब्रेन स्टेम डेथ और इसका क्राइटेरिया क्या है। Brain death is defined as the irreversible loss of all functions of the brain. Criteria is absence of motor reflex, pupillary reflex, cordial reflex, gag reflex, sucking reflex, caloric response. इन सबके बाद अगर परिजन सहमति देते हैं, फिर उसका पेशेंट को ट्रांसप्लांट सेंटर में शिफ्ट करने के बाद एपनिया टेस्ट किया जाता है और फिर ऑर्गन डोनेशन की प्रोसीड करते हैं। नेक्स्ट, हम इतना पीछे क्यों हैं? एक तो कुछ जागरूकता की कमी है। इवन हमारे भोपाल में भी डॉक्टर्स में भी जागरूकता की कमी है। और आप भोपाल के बाहर इंदौर भोपाल छोड़ दें तो बाकी जगह तो मतलब डॉक्टर्स को भी उतनी नॉलेज है जितना एक ले मेरे को भोपाल इंदौर के अलावा हमारे मध्य प्रदेश में। नेक्स्ट, लगभग 550 हमारे 550 ट्रांसप्लांट सेंटर है, तो शायद 95% ही प्राइवेट सेक्टर में होंगे। सिर्फ 20-25 शायद गवर्नमेंट हॉस्पिटल्स हैं जो जहाँ पर ट्रांसप्लांट होते हैं। हमारे एरिया में भी ट्रांसप्लांट होने लगी। नो नेक्स्ट, माय रिलीजन डज नॉट अप्रूव। इससे सबसे ज्यादा जो डर होता है वो हमारा धर्म की बातें है। जैसे अभी ब्राह्मण कुंभ सम्मेलन हुआ था तो वहां पर उन्होंने हमें बुलाया था, तो मुझे बड़ी खुशी हुई कि लोग आगे आ रहे हैं। उनको कम से कम भोपाल इंदौर में तो बहुत जागरूकता है कि हाँ अंगदान कुछ होता है, नेत्रदान होता है, त्वचा दान होता है। तो धीरे धीरे आगे बढ़ रहे हैं, अभी समय लगेगा। एक डर रहता है कि हमारी बॉडी खराब ना करके उसको पता नहीं क्या करें, हमें नेत्रदान करने का बोला है, एक किडनी भी ना निकाल लेंगे, मतलब यूजलेस है। सारी चीजें जो भी ये सारा प्रोटोकॉल होता है और जब भी रिट्रीट करके ट्रांसप्लांट होता है, जैसे सरकार का होता है या मोबाइल हॉस्पिटल में, तो एज पर वेटिंग होता है। ऐसा नहीं है कि मेरा भाई है तो उसको 2 दिन में दिला दूंगा किडनी, एज पर वेटिंग ही मिलेगा। गवर्नमेंट इसको अप्रूव करती है, नोडल ऑफिसर होता है, तो उसमें चीटिंग नहीं होती है हमारे कहीं भी। हाउ टू इम्प्रूव, जैसे एक्सीडेंटल डेथ्स बहुत होती हैं। एक्सीडेंट के बाद पेशेंट प्राइवेट या सरकारी जहाँ भी हॉस्पिटल में एडमिट होते हैं तो उनको पता होना चाहिए कि एक्सीडेंट केस है, अगर वेंटिलेटर पे है तो हमें डेली रिपोर्ट करें। एक पोर्टल हो, ऑल ओवर एमपी का पोर्टल हो, जहाँ से डेली डिस्ट्रिक्ट हॉस्पिटल से भी हमें एमपी में जहाँ भी पोर्टल लगे बीसी हॉस्पिटल है वहाँ पे डेली रिपोर्टिंग है ब्रेडेड पेशेंट की या जो एक्सीडेंट वाले। सबसे ज्यादा जो ऑर्गन ट्रांसप्लांट होता है वो एक्सीडेंटल पेशेंट्स के लिए अधिक होता है, क्योंकि उनकी उम्र कम होती है, 30 साल के लड़के होते हैं, 20 साल के, और दूसरा ब्रेन हेमरेज या कुछ और मेडिकल कंडीशन के बाद भी होता है। नेक्स्ट, एक पीछे जैसे मैंने बताया कि हमारे नोडल हॉस्पिटल या नोडल सेंटर और रिपोर्टिंग ऑफ ब्रेन डेड पेशेंट्स शुड बिकम कंपल्सरी फॉर ईच हॉस्पिटल एंड हेल्थ केयर सेंटर, पब्लिक एज वेल एज प्राइवेट, इंक्लूडिंग ऑल द डिस्ट्रिक्ट्स। जब तक ये नहीं होगा हमारे पास पेशेंट की अभी जैसे मैं आपके डाटा दिखाऊंगा हम कितना पीछे हैं, और it should be compulsory to ask and take written consent from family members regarding organ donation by the intensive care doctors in the event of brain death। जैसे डेथ के बाद डेथ सर्टिफिकेट होते हैं, फॉर्मेलिटीज होती हैं, उसमें एक और जैसा एक और फॉर्म होना चाहिए जिसमें हम पेशेंट को ये बताएं आप घर जाने से पहले या आपके पेशेंट की डेथ हुई है तो आप आवेदन नहीं करना चाहते तो ये फॉर्म साइन कर दें। तो मेरा मानना है कि अगर हम ऐसा करेंगे तो कम से कम 2% 4% लोग तो उन्हें पता ही नहीं होता, वो तो डेथ हुई घर जाना है। तो अगर हम उनसे फॉर्म भराए साइन करा ले बस, या उसमें 4 लाइन उस फॉर्म में भी लिखते हैं ठीक है आप आवेदन करना चाहते हैं नहीं कोई बात नहीं, तो इससे भी शायद थोड़ा सा मालूम है। नेक्स्ट, टोटल ऑर्गन ट्रांसप्लांट्स, तो नंबर्स डेफिनेटली बहुत बड़े हैं। जैसे हम अगर 15, 16, 14 में देखें तो 1500, 2000 के करीब ऑर्गन कैटेगरी प्रोविजन की मैं बात कर रहा हूँ। 1,500 होता था, जो लास्ट ईयर 2700 था। ये 2700 पैसे 2765 जो ट्रांसप्लांट हुए ऑर्गन्स मिले, ये 908 पेशेंट्स थे जिन्होंने कैटेगरी का ऑर्गन डोनेट किया, जिससे हमें 2765 ऑर्गन्स मिले। नेक्स्ट, इंदौर। ये इंदौर में टोटल अभी तक 150 ऑर्गन ट्रांसप्लांट हो चुके हैं अभी तक। इस साल भी हुए लगभग 5 out of 5 patient 5 category deaths. Next, top 5 states. अगर हम लोग जैसे साउथ में सभी को मालूम है, मतलब ये हाई डोनेशन तो कंपलसरी है। जैसे हम लोगों को क्या होता है, माल निकालना है या जो भी प्रोटोकॉल होता है, वहाँ पर तो मतलब वो जब फ्यूनरल की जाते हैं तो वहाँ पे वो पूछता है आपका हाई डोनेशन हो गया, मतलब ये ऐसे प्रोटोकॉल हो गया वहाँ, हाई डोनेशन तो कर नहीं है। श्रीलंका छोटा सा स्टेट है जो दुनिया को ऑर्गन सेंड कर रहा है। तेलंगाना, तमिलनाडु, कर्नाटक, गुजरात, तो हम मध्य प्रदेश इतना पीछे, तो हमें कम से कम 20 गुना आगे बढ़ने की जरूरत है, उनके बराबरी मानेंगे। और जैसे एक आपको याद होगा 27-28 साल से एड आता था अमिताभ बच्चन 2 रोज जिंदगी की बस पोलियो का, तो मेरा भी विश्वास है जैसे पोलियो 10-12 साल से हिंदुस्तान में एक भी केस नहीं है, तो मेरा विश्वास है शायद 20-25 साल बाद हमारे पास डायलिसिस की मशीनों की जरूरत नहीं होगी और सबको किडनी मिलेगा, मिल चुका होगा, और या जिसको भी जरूरत होगी 1-2 महीने में उनको मिल जाएगा। नेक्स्ट, भोपाल में हमारा पहला ऑर्गन डोनेशन हुआ था 14 अप्रैल 2017 में, और उसके बाद से अभी तक सिर्फ 18 लोगों के कैटेगरी डोनेशन हुआ। एक बार सुबह सर इंदौर से भी लेके आए, जबलपुर से भी लेके आए। नेक्स्ट, लाइफ वर्सेस कैटेगरी ऑर्गन डोनेशन हमने देखा 15-20% है। Almost 1.5 lakh deaths per year due to road traffic accident, और रोड ट्रैफिक एक्सीडेंट में कम से कम 10 से 15% लोगों का ऑर्गन डोनेशन हो सकता है। नेक्स्ट, जाने से पहले 4 लाइन में कविता सुनाना चाहता हूँ। जिंदगी की देन है, जिंदगी को वापस करो, दुनिया से विदा होने से पहले अंगदान करो। किसी को मिले जिंदगी, किसी को नई नजर, नई धड़कन मिले किसे तो अंगदान करो। जीवन तो सभी जीते हैं, मौत भी सभी को है, मौत के बाद जिंदगी चाहो तो अंगदान करो। थैंक यू।
Thank you for a वेट। इसको बंद करो यार, बंद करो। इसी फील्ड के हो ना? हाँ, समझा करो ना, बाण मेरे मुंह पर थोड़ा मारा जाता बाण ना। हाँ, प्लीज। Thank you for a wonderful presentation. जो आपने बात बोली, I've heard some other doctors also say it कि और बहुत कम पैसे में हो सकता है कि अगर गवर्नमेंट अपॉइंट्स इवन 1 or 2 persons, सामने बैठे इन्होंने बोला था, and you can go around inspecting in a random manner, तो लगता है कि काफ़ी उसमें बढ़ोतरी हो सकती है उतने में ही। Apart from that, what you said कि यहाँ हमारे लिए भी, तो वो छोटा मोटा तो BIC कर सकता है कि डॉक्टर्स को अवेयर कराना, दैट पार्ट वी विल ट्राई एंड डू इट। इसके बारे में किसी और को कोई क्वेश्चन पूछना हो? वन पार्ट विच दे आर दीस डेज प्रमोटिंग रियली इज दैट दे आर सेइंग कि स्किन का जो डोनेशन है उसको बहुत प्रमोट किया जा रहा है, सेइंग दैट यू डोंट नीड टू मैच एनी ब्लड एटसेट्रा एटसेट्रा। तो हाउ इज दैट all that useful compared to other body organs? मतलब उसकी इतनी जरूरत है क्या?
इसकी डोनेशन में जैसे मीडिया है, पेशेंट अगर रोज स्किन डोनेट करेंगे तो भी हमें कम पड़ेगा, नहीं ज़्यादा रिक्वायरमेंट है इसकी। स्किन जैसे हम ब्लड डोनेशन करें उसको लाइफ भी डोनेट कर सकते हैं, पर लोगों में अवेयरनेस नहीं है। जैसे मेरे पास मीडिया से फोन आया कि सर हमें स्किन चाहिए, आपके पास कहीं बैंक की कुछ, तो मैंने कहा बैंक की कर रहे हो, तो पूरा ये तो हम टाइम तो नहीं, वो डर गया आर एस, पर एक लाइफ हम कर लेंगे तो कई लोगों को पता नहीं होता कि उसके भाई बहन किसी से भी लेके भी है, दोस्त की भी लेके ट्रांसप्लांट।
Thank you for this. Any other questions? किसी को कुछ पूछना? Otherwise we move to the next session. कामिनी जी, if you permit, हम थोड़ा ऑर्डर आगे पीछे कर लें क्या कोविड का 10-15 मिनट, है ना? डॉक्टर भारत भूषण को we will listen from US और फिर उसके बाद आपका कर लेंगे.
Sorry.